Dr. Amesh Adalja. As always, Dr. Adalja, it's great to have you on this issue of measles and the stats that we ran through and everything that you know about what's going on. What does it say about public health in the United States right now, if anything?
It tells us that we're going backwards, that people are voluntarily choosing a lower standard of living, that we're losing our mastery over measles. And not because the virus changed, it's because people are turning against the science and technology that kept measles at bay for 35 years in the United States. And this is going to be what we see moving forward, that measles is establishing itself as an endemic disease right before our eyes.
How much of a danger is it to us for the general public? What's the big picture story here?
Well, the big picture is that measles leads to children needing to be seen in emergency departments, getting hospitalized, and some of them getting very severe complications like pneumonia or brain infection, as well as people dying. And back in 2025, we had 3 people die in the United States of measles. That's basically unheard of.
Next topic, the parasite. It's getting so much attention, and we've talked about it a bunch on this show. One of the things that I guess I'm interested in, these parasite cases hitting a record high. Well, first, let me ask this, before I get to some specifics on what's going on at the CDC and what stands out about this parasite story to you? What
stands out is it kind of illustrates our global distribution of food, that a contamination can occur in one country and it can lead to cascading impacts all over the country, and disruptions in people's lives, disruptions in the food supply. All of that can happen just from one infectious disease. And I think what stands out is that it took a while to actually understand what the vehicle was, what the source was, this iceberg lettuce. And that led to a lot of uncertainty and a lot of panic. I was at places where people would not eat the lettuce on their plate because of that. And I think that was very dramatic to see how a foodborne illness can just impact the day-to-day lives of people.
When I said I was going to ask you about the CDC, and you say it took a while to find out, like the Parasitic Diseases Division down by $29 billion. Like, in other words, that was cut out of it compared to 2025 at the Centers for Disease Control and Prevention. So do you connect the dots in terms of the cuts being made and something like this happening, or is it just too difficult to do that?
I do connect the dots, because if you have less people working on a problem, less people sifting through the data, trying to find the common denominator among cases, it's going to take longer to find that source. So yes, I think the infrastructure that we're lacking at CDC and state and local health departments directly impacts the resiliency of a country, a state, a county to infectious disease outbreaks. And I think what we see is infectious disease kind of go through boom and bust cycles. They fund it, then they don't fund it. It goes through these panic and neglect cycles. And when it's in that neglect cycle or that bust cycle, this is what you see. Outbreaks like cyclosporiasis, measles outbreaks, and the like. And that's what people have to understand, that you have to be proactive. You can't just be reactive with infectious disease, because they're always there. And it's our infrastructure that keeps them at bay.
So more of this kind of thing in this type of cycle popping up.
Exactly. That these are kind of what I call the barbarians at the gate. They're still there. They're always there. All these infectious disease threats that have plagued our ancestors for millennia, they're there. What keeps them at bay is our science, our technology, the personnel, the labs, all of that. So as soon as you let that guard down, they surge right back. It's not surprising. It's not rocket science. This is what humans have dealt with basically since we've been on this planet. And it's our science and technology. It's the minds that gave us all those tools. If we're turning away from those tools and turning away from those systems, the same thing that happened to our ancestors happens to us.
Dr. Amesh Adalja, Johns Hopkins. Thanks, Dr. Adalja. We always enjoy your insights on all these and all your experience.